Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amy.
And my name is Sarah.
And we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Hi and welcome everyone. I'm so excited for the guest that we have. You know, Sarah, this particular physician, he is kind of a badass. I mean, we've seen some of his activism online. I think that we're fortunate to have another physician that's championing some of the work that nursing has been doing. So how about I hand it over to you, Sarah, and you can introduce our guest.
I am super excited to have this guest today because he has been actively and openly supporting nurses throughout this pandemic in a lot of the struggles that we have faced. So without further ado, I'd like to introduce Dr. Chris Keefer. He's an emergency medicine physician with an interest in activated learning through simulation-based medical education. He is the director of EMDeliberate practice, a high-risk medical procedural training course. He is also the founder and director of Doctors for Nuclear Energy. Dr. Keefer is pro-nuclear climate and clean air activist and the host of the Decouple Podcast and WeCANDUIt podcast. Dr. Keefer is the president of Canadians for Nuclear Energy, a grassroots nonprofit made up of climate, health, and labor advocates. Welcome, Chris. It sounds like you are the jack of all trades plus more. We're so excited to have you today.
Well, it's wonderful to be with you guys. And I mean, that's certainly the joke they make about us emerge docs. Jack of all trades. And, you know, I'm trying to master some, but yeah, a lot on my plate. But it's such a pleasure to be on your podcast as a fellow podcaster. I know a lot about what goes on behind the scenes, so it's just fun jumping on someone else's show. So thanks again for having me.
Awesome. So I was just wondering if you could tell us a little bit more about your background in medicine, kind of how you got to where you are today.
Sure. Yeah. I mean, there's always that like med school interview question of like, so why do you want to go into medicine? And for me, I mean, it started pretty young. I actually was really not great at math. I mean, I just didn't like it, so I didn't try very hard. But I was really into like the physiology side. I had a sort of social justice bent, and I was actually in undergrad doing a fine arts degree, doing some painting and sculpting and some humanities courses. And I just really wanted to have I was writing some pretty badass papers, making some great arguments, but I wanted to have a concrete skill. And I got really inspired by Dr. Paul Farmer, who is an infectious disease doctor who runs Partners in Health, which is I guess it's like the least NGO-y of the NGOs in terms of actually like working with local health systems, not undermining them, but strengthening them. But in any case, he does some amazing work in Haiti, mostly, working on access to healthcare and strengthening health services there, and was a very inspiring figure. And so I thought, hey, why don't I give this a try? I was in second year university, I went back to high school and brushed up on science and math and went into medicine. And, you know, it's a big gamble, but luckily it paid off. And yeah, I mean, my motivations, I think, were very much rooted in questions of social justice. And I remember, you know, when I was starting medical school, I was like, you know, the kind of activism I've been doing, like you can all bring it back to health, right? I mean, fundamentally, my core values are around helping individuals, people achieve their full potential and removing the kind of systemic barriers that remove that full potential. And I was like, if you can, you know, describe this in the language of health, then everyone will be on board. And I kind of assumed I could radicalize my entire med school class into progressive activists, and kind of remember the disappointment of that not quite being the case.
No, I think this is where you can continue to expand, because when it comes to activism in nursing, we weren't really taught about activism. We were taught about how to advocate for our patients, but in terms of, the political and social advocacy that we do ourselves now on our even on our podcast, wasn't something that was, talked about, or that was something that was seen to be done in nursing. So like I'd like you kind of to dive a little bit more into that, in particular with medicine, because it's really important. And I don't understand why we don't talk about social justice in healthcare.
I mean, it is really interesting because with physicians, we have the can med roles that, these include things like, being a manager, being able to sort of steward resources and apply them in the right directions. But one of them is to be an advocate. So it certainly gets some play. I'll say I have my sort of like Andy Warhol 15 minutes of fame back in, it was 2012 or 2013. The Harper government at the time had just cut the refugee health benefit, the interim federal health program, in a really draconian way. It was super gross. I mean, you could get treatment for, I think it was HIV and TB, but if you were suicidal, then you wouldn't be covered, right? So it's very much, if you could get a Canadian sick, then I guess we'll have to cover you, otherwise not. I mean, it excluded refugee women who were pregnant from getting prenatal care. It removed the support for buying insulin for diabetics or refugees. So this really annoyed me and a number of other physicians that I was working with. I mean, there's always that sort of like radical health area. There's you'll find communities within whatever profession that are more on that side of things, and we organized a series of disruptions. So every time a conservative MP from the Harper government would give a press conference, we went and interrupted it. And so the very first one happened at Toronto General Hospital when Joe Oliver, who's actually the Minister of Natural Resources, came to make an announcement about isotopes. And I stood up in the press conference, interrupted the press conference, drawing attention to the issue of the interim federal health cuts. And it was just a very strange sort of bit of choreography. It wasn't handled particularly well by either the minister or by the Bob Bell, who was the president of I believe, I'm not sure if it's UHN or which group of hospitals, but it turned into this really big media moment. It turned into a bit of a viral video that got 250,000 views or something like that. And this isn't just to tell a self-indulgent story, but it's funny because that video has actually now been used, I've been told, by a number of medical schools with their medical students to talk about, okay, can med roles, advocacy, like, does this fit? Is this kosher or not, right? Because it was a pretty big deal, disrupting a federal minister, disrupting
Right.
a press conference at a hospital, confrontation with the government, with the CEO of the hospital. And, I did actually get to go and speak at my alma mater at McMaster University and speak with some of the students, and it sort of addressed that and hear their takes like, oh my God, and we feel this is totally inappropriate, to other people who are like, yes, like we need more of this in medicine. So it's been interesting to become a part of that can med debate, and what is the right place for healthcare professionals to take in terms of advocacy.
Yeah. No, I was gonna say, I think that's awesome, and I need to go look for that video now, and I bet anyone that's listening is gonna Google that right now, because I think it's pivotal, right? We need people to disrupt the system and really challenge long-held beliefs by people that have been in power for a long time, and this is something that Amy and I try to do. And I know that you have been advocating for a number of issues for a long time, because even when I was looking for that open letter you penned on behalf of nurses, I saw that there were a number of other open letters that you've written in the past. And I'm just wondering, was there any particular moment or incident that sort of inspired you to write this letter to support nurses? Because we are so grateful for what you've done, and really you got the conversation going from a physician perspective. Like,
Mm-hmm.
what sort of made you want to write this letter?
I mean, a lot of things. The department I work in has been hit really, really hard by this whole sort of crisis in terms of nursing retention. And the stat I've heard is we've lost something like 50% of our nurses. And even when we bring in new nurses, people don't even learn their names before they leave a lot of the time. And so that's been really concerning, and it's been sort of bubbling in the background for a while. But it's really just through kind of conversations that I started having on the job and off the job with some of my colleagues that really brought it home for me. Like, we're in the Emerge, we're a team, we're a family, we work together. Where it's a really beautiful environment that way. And I don't know, it's just like when you see a member of your family getting beaten up, you want to stand up for them. And so, yeah, just through having these conversations, it really led me to think, well, I've got this history of advocacy, and I've got some know-how to raise awareness around an issue and advocate. So, what is it that I can do? And I was thinking about, oh man, we should organize like a march at Queen's Park. We should do this, we should do that. But just in terms of the, very kind of much an emerge triage focused thing, like what's the, with the limited resources I have at this moment, like what's the biggest thing I can do? And so I thought, oh, okay, I'll write an open letter. And luckily, I have some friends that are very well connected, and we're able to really get it out into a broader network. And it got 400 signatures within 2 or 3 days from emergency physicians across the province. And, I have been a part of physician advocacy in the past that hasn't been related to issues just of physician benefit. I think, myself as well, I'm a bit of a cynic, but sometimes I've been frustrated when physician advocacy has been only limited in terms of kind of, okay, well, this is our self-interest, or, we want to renegotiate our schedule of benefits or this, that, or the other. I've been really inspired when physicians have done stuff through that CanMed role for things more generally, like the refugee interim health program. And this just feels like such a vital issue. I really don't think people understand the depth of this crisis and the threat it has to, not just public healthcare, but healthcare in general. We're already in too deep into this retention crisis, and it's going to take 5, 10, 15 years, to sort of rebuild what we've lost. And I'm really worried about that for my patients, and also just for my family in the ER. So that's what motivated the letter.
Yeah, I really like how the letter was written because you say that, emergency departments are in crisis, and this time it's not due to the lack of beds and ventilators, it's due to lack of nurses, which I think sometimes the public doesn't realize. Like, it's not like a bed is just a bed unless you have someone to provide that skilled care, right?
Mm-hmm.
And the fact that I really like what you said here, every single one of us will be cared for a nurse at some point in our lives. They will carefully administer us essential medications, change our dressings, bathe us, and be at our side day and night to accompany us through our illnesses. And I don't know how many other professions that are out there where you could say the same thing.
Mm-hmm.
Like, literally, all of us will need a nurse at some point in our lives, which maybe people forget when they're healthy and they don't really need any medical care.
Well, by need, it's like it's a need. There's like you might pass through a number of other professions kind of in a way that's not as it's not as intense, right? My dad's been in and out of the hospital a number of times, and yeah, like it's before we had healthcare, before we had these roles. This is what a family member might do for a sick elderly person in the home, and it's a huge burden. A lot, like hands off, a lot of people still do that. That caregiving work is critically important. It's exhausting. It's really hard to do, and so we're really lucky that we have dedicated professions for it. But when I hand my father off and he's admitted to hospital and he's looked after, like obviously it's the whole medical team. It's the imaging, the testing he's getting, all the high end stuff. But really, it's the nurses that I'm really so grateful for, because they're fulfilling like that family role, right? Like I go in there and I might kind of give him a little sponge bath or something, but just to know that there's someone there who he's connecting with for his family that can't be around him 24/7. That's kind of what strikes me. That's what I think is so potent about a role that's not just that though as well, right? And I think that's something that's really misunderstood and I've heard nurses say, like, we need to come up with a new word, because nurse just is very antiquated and it doesn't talk to the very high level of skills that you guys have as a profession. There's a nursing week that we celebrate every year. And I'd wanted to sort of get together with some of my colleagues and make a spoof video about, a what if scenario if the emergency department, all of a sudden there were no nurses and it was just all doctors trying to run the department, and what an absolute disaster it would be. I think of my own math skills and mixing meds and
Yeah.
Dilutions and things like that. There's so much to what you guys do, and we're so appreciative of it. So that's what the letter was trying to get across.
I'll be honest, we're grateful that you wrote that, because I feel that, there has been kind of like a long-standing history of somewhat of like tension and animosity
Mm-hmm.
between, nursing and physician staff. Not all the time, but there are those stories that we hear and we get to. But it's important to have, that physician involvement to help support. And I think that, you talked about repealing Bill 124,
Mm-hmm.
which caps nurses' wages at, it's actually less than 1%. And you also said, like your healthcare depends on it. But what else do you think needs to change in relation to nursing support, and how can we get more physicians involved in some of the work that you're doing? So I know that you got almost
Hmm.
300,
Sure.
400 physicians signing. There's a lot more physicians in Ontario. How do we mobilize the rest of them to help support nursing?
I mean, yeah, first off, this was just ER physicians, right? So it wasn't open to everybody else. So that's a large number of ER physicians. And I haven't actually
Absolutely.
gone back and checked the Excel spreadsheet. I think it's probably at more like 700-800 now. But certainly I think your question is critical. Just to sort of go briefly on one little tangent here, the impact of writing that letter has been really, really powerful, not just in terms of the media attention that it got and the way it put the issue on the agenda, but also just the morale boost for my nursing colleagues to see, hey, well, we are a family, and we actually, this is a concrete, demonstrable, like showing of solidarity and support that we need right now. Right. I think physicians they try and make a lot of gestures. Like I know our group sort of like, buys the dinner and drinks at the Christmas party, or we'll make
Hmm.
cards or like little displays how much we appreciate our nurses, and that's nice stuff, don't get me wrong, but my strong sense at the time was like that's not what's needed. And in a way, it's not that it's insulting, but it's like, hey guys, like we're drowning right now, like we don't need like a candy lifesaver, we need an actual lifesaver, like
Right, right.
we need you guys to step in. So this felt like a really concrete way to make that happen. um, I think as more and more physicians become aware of this, I became aware because sections of our emergency department were being shut down because there weren't enough nurses to staff it. I think that
Yeah.
was really the kind of like whoa moment for me, and I think that's going to become more and more commonplace as this crisis continues, and more docs are going to be aware of it. They need to be sort of equipped with the analysis, with the sort of trailblazers who are doing the communications to understand sort of what pragmatic steps to take next. Our physician group actually came together and made a vote to donate money to this grassroots nursing campaign, Nurse with Sign 416. And that was something that I thought was really, really incredible. I wasn't sure how it would go over with my physician group, but 92% of us voted to make a pretty decent donation to this grassroots activism and advocacy. And so I think extraordinary times call for extraordinary measures. And I'm hoping, this podcast as well, hopefully there's some physician listeners that will find ways to come together and support one another.
Yeah, I think that's really good that you talked about something tangible. And just going back to Nursing Week, it's every year in May,
Mhm.
and I think that it's sort of like it's like when we talk about Black History Month, when we talk about Nursing Week, it's a lot of people view it as this once a year thing. You check off a box and then it's done. But really, what we need is support year round, and Nursing Week is a reason definitely to do that. But it shouldn't be just a one off. And I'm really glad that you thought about the fact that this is what's needed, because it is kind of insulting sometimes on Nursing Week when you get a keychain, or you get like a water bottle, and it's like that's the last thing you need right now. You actually need
Right.
support to do your job properly and safely, to get the training that you need. And like you said in your letter, nurses have been trying to, they've been showing how they feel with their feet.
Mhm.
And by that we mean leaving the profession or leaving the bedside. And I'm just wondering, like, in terms of relationships between physicians and nurses, I know that, you know, historically there might have been some tension. Just wondering how you feel about that. Do you feel like there is tension between physicians and nurses, like, or has it changed during the pandemic?
That's a good question. I mean, it's interesting just looking back historically, right? And the way that hospitals, I think, used to sort of, they almost ran like a navy ship, right? And from what I hear, I've never seen this, right? But the doctor would walk onto the ward, and the nurses, all in their uniforms, would stand up and almost like salute when the doctor came in. And
Yeah.
like obviously, you know, that's before my time, and I think it's a strong consensus that those days being dead is a very good thing. I think I've been heartened by, especially doing simulation education, where we really bring multidisciplinary teams together and eliminate the hierarchical environment and realize that we all have very specialized roles that can inform each other, particularly in situ simulation, where you're really figuring out a lot of the sort of systems barriers. That gives an incredible appreciation to how important it is that we all work together and that we really acknowledge the strengths that we each bring. In regards to the pandemic, it's an interesting question. I think there's been a lot of just being in this kind of this crisis mode. that's maybe made us a little bit more, and I'm just riffing here kind of from my individual experience, but like a little more inwardly focused. I think as the nursing crisis and the retention crisis comes more and more into focus, I think it is a real opportunity for us to speak together and to work more closely together. And I mean, even if you just like in the narrowest of self-interest, if you're a physician who just doesn't respect nurses, doesn't really care. I mean, if you want a workplace that works, like you need skilled nurses around. I think everyone can see that. So there's a real broad alignment here. Um, and I think a real opportunity for things to change. Because what I'm also seeing as well is a lot of frontline nurses who are becoming empowered by this activism, who are coming out publicly. Like that was part of the reason why I started off writing this open letter and got the ball rolling, was because there's an environment where nurses are too afraid to come forward to the media. They fear retribution, losing their jobs, etc., in a way that doctors don't need to worry about. And so, I step forward like to use that privilege that I have in my profession. But it's been amazing seeing that fear fall away and seeing some of my colleagues who have come out publicly, like Nancy Halupa and Leah Waxman, Helen Winter, and others, who've said, you know what, like I'm at the end of my rope and I care about this issue enough that I'm going to identify myself. And that's been really powerful, because then they've been able to be, spoken to directly in the media, to be interviewed, to have their voices heard. So I'm really excited about moments like this, which they arise out of really difficult situations, but they kind of allow the rule book to be rewritten, and I think to make changes that should be fundamental and long lasting.
That's kind of what I hope for the pandemic too. I really hope that the sense of solidarity and the sense of support from our physician peers will kind of continue onwards. But
Mm-hmm.
another aspect is, with advocacy, it's a double-edged sword, right? So, we're going out, we're saying here are some of the changes that we need, but we're also seeing the negative aspects and consequences of, saying that we need to see change. And for example, you probably have heard and seen counter protests. And my question to you is, how do we manage these things, especially, for example, when, like, here's one of my concerns. I'm going to be coming out October 3rd to stand with nurses in
Mm-hmm.
solidarity, to say, we need to get rid of Bill 124. We need to encourage people to get vaccinated. But on the other hand, we know that almost every weekend we're seeing these counter protests of, the health misinformation, and some of them call themselves
Mm-hmm.
nurses. So what would I, and it's not even just nurses, there are certain physicians that are a part of this. What
Mm-hmm.
is it that you would like to say to them at this point?
Well, I think that the October 3rd rally provides a really, really important opportunity for the public. Like, nurses are going to be there. I hope a lot of doctors are there, but I really hope the public shows up as well. I'm doing my best to get the public out there, because it's this kind of protest on October 3rd is the antidote for these anti-vax, anti-mask protests that have been targeting hospitals, and even schools in BC, I've heard. It's a time at which, we're having faced the fatigue of this marathon of COVID and now a fourth wave, which is vaccine preventable. It's such a disheartening time for healthcare workers, and particularly, again, nurses who are the ones and who have been the ones filling in for family members, especially when visitation has been so limited, sort of being the family member, holding their hands. To have anti-vax protesters harassing you at this time is such a deep wound. And I think the public, really repudiates these anti-vax, anti-mask protesters. And I hope that we can give them an antidote, again, like I said, to that. If you were someone who banged a pot and pan, during the first months of the pandemic every night at 7 p.m., like this is the time to bang that pot and pan. And this is a way to make it really concrete. Like this is nurses asking for your help and solidarity at this point. Not just because, hey, like, the cost of living is going up and we can't afford our mortgages anymore, et cetera. But it's, we care about healthcare. We care about our profession. We don't want to leave our profession. We want young people to come into this profession. Like that's what I found to be so inspiring, is that, nurses are so burned out, so exhausted. But the ones that I'm working alongside organizing these campaigns, they're putting in the time on their off hours. I mean, it's actually becoming a source of energy for them, because they see themselves as like protagonists now, able to make a positive change. And that's a really, really powerful thing that's come out of this whole activism about the retention crisis.
Yeah, I think that's important because nursing has traditionally felt very silenced, right? There's a lot of fear. So
Mhm,
not just from their organizations, from their union, from their college, but sometimes even from each other. You know, they
mm.
don't nurses don't always support each other in the advocacy or going out into the media, and I think that's a problem. But what Amy and I are trying to do, and maybe what you're trying to do too, is role model the change that we want to see. I would love to see more nurses, you know, active on social media, talking about these sorts of issues, or joining us in the media doing these radio and TV interviews, because I think it's so important to hear from people that are actually experiencing it. And if we don't speak, then we're really allowing others to speak on our behalf.
Mhm.
And we definitely want the narrative to be in our voice. That's really important to us. And so I think that's something that I would like to see change. I don't know if things have changed yet, but Amy and I have noticed, you know, a few nurses that are joining us and becoming more vocal, and we really encourage them to do everything they can. And, you know, if people are not sure how to get started or they're afraid of something, like, we're happy to share our experience with them.
Yeah, the nurse, like this whole Nurse with Sign Instagram account, it's such a powerful, powerful thing, right? I mean, I'm kind
Hmm.
of in that age group where I haven't mastered Instagram by any means. I'm a Twitter guy, um, but you know the poignancy of the messages that they can fit on a tiny little placard or piece of paper, and the realness of, you know, taking those photos at work or in PPE or whatever, um, you know, and it's just so different than sort of the more sort of bureaucratic messaging that you see from you know, from the unions, et cetera. Not like I'm not bashing on the unions here, but there's something
Hmm.
really exciting and it's just not reproducible of that kind of grassroots energy, and really, you know, being friends with and colleagues with the founders of Nurse the Sun 416. It's been really amazing seeing that campaign and seeing just how powerful it's been. And they've actually managed to fundraise money now to have those images from the Instagram account flashed on the Young and Dundas huge screens downtown. So, I mean, it's incredible. It's kind of a shame that like they're having to do this on their like the small kind of time off work that they have. But on the other hand, no one could do it better than them and everyone else who's contributed to that campaign. So just a huge shout out to Nurse with Sign 416. And I think it's modeling, as you were saying, within nursing culture, if I may be so bold from as an outsider to say this, but I think it's really modeling like, hey, like we need to not be afraid and speak our minds. I mean, in some of the communications, the way in which I see nurses talk to is very paternalistic, or I don't know if that's the right word, but like almost like, oh, children behave now, you know? And like
Yeah, yeah.
like having been included on a few email threads where I've seen this kind of pattern of behavior, I was just like blown away, blown away. Like no physician would ever accept being spoken to that way. Um, and
Hmm.
it was cool seeing nurses saying, you know what, no, we're not going to take that. No, you don't get to talk to us like children. Like we're a vital profession. And I mean, it's interesting that, you know, things being as bad as they are, I think some of these nurses are less afraid of the consequences or the fears they used to have of retribution from within their institutions, because they say, you know what, fire me. What are you going to do? You're
Hmm.
going to have no one left to run your. So there's almost like a political power in the shortage, which is like a very interesting dynamic. I'm seeing a level of empowerment, which is really exciting, which is like people are afraid of, people in management, et cetera, are afraid of, but I think is very powerful. If you're not afraid of it and trying to snuff it out, that kind of energy, it's well intentioned, and it's ultimately it's people on the very front line, I think, that are most aware of what's going on and the changes that need to be made.
Yeah, I mean, I know you might not be able to say it, but myself and Sarah can say it. Where it's just like, you know, we've experienced that. We've been on the receiving end where, you know, not in the current organizations that we're working with, but in previous organizations where, you know, that language where they feel that it's acceptable to speak to a nurse this way, they get away with it, right? Like, I mean, I remember
Mhm.
even saying one time to Sarah at a previous organization that we both worked, the way that they would talk to myself and Sarah versus now, if a doctor walked around the corner and then they had to speak to them, it was like night and day. And I was like, well, you know what,
Mhm.
I should still be respected as a human being, like at least have the
Right.
respect for me as just a human being. And this is where we keep on talking about, you know, really illustrating to the public what nursing is all about, because I think that that narrative has been written by a lot of other people, and the
Hmm.
respect for nurses isn't really there. And I think with this groundswell of what we're seeing with this advocacy work, this ability to be like, I'm not taking this shit anymore, because that's really what it is, right? The
Hmm.
powers that may
Right.
be are putting pressures on, and really actually, intimidating, gaslighting, causing fear in nurses where there really actually shouldn't be. It's not a problem to go
Right.
out and advocate about social justice issues. It shouldn't be a problem to go and advocate for the fact that, nurses have been trampled on and are being really exploited at this point in terms of the work that we're expected to do. We're continually expected to do more and more with less and less, and it's
Hmm.
unacceptable. We have to get to this point where we're saying, you know what, enough is enough, because we can't continue on the way that it's going. And the thing is, you know, I'm glad that nurses are standing up. This is something that we should have been doing years and years ago. And I know I wanted to echo one of the things that you had said, where you said, you're not of the age where, a physician walked in and everyone saluted, but it's kind of unfortunate that that perception has been taught to us in nursing. Like, I can remember, and this is only
Hmm.
like, within the last 10 years, where I was told by a clinical instructor that if a physician comes, I need to give my seat up to him so he can chart in Meditech or document or whatever the case
Hmm.
may be. And I
Hmm.
was like, this is crazy. And I think that
Hmm.
we really need to move beyond that aspect, and really challenge our leaders and our peers and our colleagues, that is it wrong for us to not accept the status quo? It absolutely isn't. Like, I think this is the work that
Hmm.
just needs to be done.
No, I was just curious. Like, so I was mentioning at the very beginning, like we're taught in medical school, you have like one of your 6 fundamental roles as a physician is to be an advocate, is to sort of stand up. I mean, they avoid the word activist because that's just, whatever. Advocate.
It's
Like,
too
is there anything
edgy.
like that? Too edgy, too
Oh,
edgy. Is there
come
anything like that
on.
in a nursing curriculum where they're like one of your roles? I mean, probably to advocate on behalf of your patients, but more broadly in society, is there any? Because I
No,
think,
absolutely
Nope.
not.
like, why should that be
Nope.
limited to doctors? Like, we have an important perspective, and I think there's a really amazing history, particularly within public health, of physicians, um, you know, really making a difference, raising their voices, using their profile. But there's no reason why that shouldn't be a nursing role as well.
In my experience, there has been advocacy from professional organizations and the union, and there's this culture in nursing where we think that they're advocating on our behalf, and so there's no need for me to advocate. Or if I really dig deep and I think about some nursing advocates, I can think of maybe Kathy Crow. I don't know if you've heard of her.
Yes, yeah.
She's huge into advocating for the homeless population, but aside from her, we're kind of like looking around like there's crickets, really. And I
Mhm.
think that it's just people are looking to myself and Amy now to kind of take this a little bit further. But at the same time, there's strength in numbers. Like, there are 400,000 nurses across Canada, and we really need to band together and create a singular message. And I think this is what's happening with Nurse with Sign 416 and this protest that's happening. I think that this is really the change that we need to see.
And
Mhm.
really, it's not modeled in nursing school. And I guess what I would say here is, it's also because nurses haven't been seen as, social and political leaders in change, right? We see physicians doing that role. We see them coming out and saying,
Mhm.
here are some, whether it's climate change or whether it's politics, we see them coming out and having these conversations in media. But nurses aren't typically seen as, people who would do that. We
Mhm.
tend to be, I don't know, I hate saying this, but we tend to be kind of, like the supporting character in the shadows. But we continually urge, myself and Sarah, to push nurses to get involved in politics, get involved in social change. Like, what are some of the things surrounding health that you think are important, that you should be a part of it and should have that conversation? And of course, now,
Mhm.
the other thing that Sarah and I do is we push the media. So we're like, hey, if you've
Right.
had that conversation with a physician, you need to pick up the phone and you need to call a nurse too. Like, we have the
Yeah.
knowledge, we have the skill, and we have the judgment. Ask us these questions. We want to be involved in the arena. If we don't have a place to help make those decisions, it just really, it excludes us. And then we also have an added voice that is actually really needed to be there.
Well, listen, I mean, in terms of the open letter, that was really informed by speaking with some of my nursing colleagues. And just, there was some really pretty intense imagery that a friend of mine shared, a nurse friend of mine shared. And, she was talking about like being pressured to zip up the body bag and get the patient out of the room as quickly as possible because we needed the bed, right? Or holding the hand of the patient that was about to get intubated, and likely, we know with COVID, more likely than not, you're not getting off that ventilator. Depends on your demographics slightly, but yeah, and the kind of emotional burden that held, and that really impacted me because, I know from my own work in the emergency department, seeing many deaths, some of patients far too young. It becomes more and more of an emotional burden. It becomes more and more difficult the more you know about the family, the patient, their context, et cetera, right? So that's something that I think I've gained a big appreciation for in terms of my nursing colleagues. Again, as I was saying, especially when families really weren't allowed and nurses had to step in and really fill in that role of accompanying their lonely patients. When a patient did die, or when a patient does die in that setting, it's such a heavier impact borne by my nursing colleagues than by myself. So it's things like that, as you were saying, in terms of the advocacy, where I can advocate and bring a certain lens. It's very important, but there's some really, really important stuff, I think, and we need to listen to all the voices on the healthcare team. And I think you guys are a really great example of that, and it's exciting, right? Like being at the forefront of something that's emerging and budding and building and a change in culture. And I really do see that happening, and I think it's just such a great, like, unambiguously great thing.
Yes, I'd say it is exciting, it is challenging, and I mean, with the good there is the bad. Like, we do get some negative flack every once in a while, especially that we're a little bit more prevalent on social media. And actually, even this weekend, I had to say, like, if you don't have anything good to contribute to the conversation, then I'm just gonna block and delete. Like,
Mm-hmm.
we get a
Mm-hmm.
lot of hate mail and hate tweets back and forth to us, and now I'm at the stage where it's just like, okay, block and move
Yeah.
on, because it's really not even worth engaging in that dialogue at that point. But I mean,
Mm-hmm.
I think the work is worthwhile, and we have to do it. So.
Mm-hmm. Mm-hmm.
Before we let you go, Chris, is there anything that you'd like to add to our conversation
We,
that we haven't touched
yeah.
on, that we missed?
I mean, it's been a very fulsome conversation, I have to say, guys. But yeah, I just have so many questions for you guys, right?
Oh,
I mean, just like, well, getting a sense of, like what nursing education is like, and that sense of advocacy was like one example of that. But yeah, I mean, it looks like Quebec stepped forward and made some sort of a gesture.
yep.
At least I know part-time
I
nurses were
saw that.
excluded, but like, what's your guys' sense of things? Like, I'm perceiving this from a physician who's well cued now to a little WhatsApp chat group. Like, it's been incredible being included in this whole kind of activism and getting the perspective. Like, wow, what a way to get a nursing perspective. And that's really enriched my perceptions and understanding of how healthcare works, I have to say. But yeah, I mean, how are you guys feeling? Is this a moment where you're feeling hopeful? What do you think the prospects are? What do you think about the march that's coming up?
You know, I want to say that I'm cautiously optimistic. Like, I think this whole pandemic has been a roller coaster for me, like both professionally and personally. Like, in the first wave, I lost my grandmother. She was in a long-term care facility,
Mm-hmm.
and of course we couldn't visit her, so we never got any of that closure. And I do think about the nurses and the staff that were involved with her care, because I'm sure they had a burden to carry as well. I just think that there's been so many insults to nursing that we're just in a kind of funny, dark place right now where I don't think we can ever go back to the way it was before. Like, something's got to change, because we're losing nurses left, right, and center. And if nurses haven't taken early retirement or haven't stepped back on their hours, then they are looking to leave the bedside. They're looking for these non-traditional roles, because I think deep down most nurses still want to be nurses, but they just can't handle what the system is expecting them to do, with more and more, with less and less.
Mm-hmm.
So I think the time is ripe, that there is a lot of change that can occur. So I don't know. I think there's many different directions that nursing could go right now.
Yeah, and if I could just add, like, I'd say the same, Sarah. I'm cautiously optimistic, but if I wanted to look at it on a grander scale, I feel like things are kind of amping up, to be honest. looking to Alberta, looking to BC, and seeing some of the stuff that's happening out there. Like, I don't know how any nurse who is going through triage protocol right now is going to be able to really bounce back from that in a positive way. I think that we need to focus on mental health. I think that is the elephant in the room that we continue to miss and not talk about, because as much as nurses and physicians are working really hard through this, and we say, oh, we see the strength and resilience of these teams. I think there's a lot to be said in terms of the mental health aspect, and we really need to focus on that. And that's one of the biggest things that concerns me. And the other part is just looking at it globally, right? I think in terms of the tensions politically, they're riling up, right? I mean, the fact that I think the PPC group is a group to watch. Like, I think some people are like, oh, don't worry about them. No, I am worried about them. Like, they received over 800,000 votes. The fact that we've seen them at rallies, and we have colleagues that say that they are nurses who are part of these groups, and they're escalating behavior when it comes to protesting outside of hospitals, protesting outside of schools, breaking into the Eaton Center over the weekend, and rallying there. My concern is, what is next? I don't want to see any healthcare workers hurt. I don't want to. There were threats of them storming UHN. I guess it would have been 2 weeks ago. And my concern
Right.
is, like, what the hell is going on with people? Like, if we
Yeah.
can't get through a global pandemic, what about climate change? What about like all these other really pressing issues? Like,
Mhm.
that's where some of my thoughts lie in terms of my concerns in terms of our profession. I think that, like you said, Sarah, we can't go back to where we were. There's no way, but we need to, again, mental health of, the people who are working, mental health of the people on the outside looking in. I think there's a lot of fish to fry. And I mean, I'm going to be optimistic. I'm going to try to be positive, but I think there's a lot
Right.
that we need to deal with moving forward through this pandemic, and after this pandemic, that there's a lot of ramifications and things that we're going to have to deal with. So that's my little spiel. I know it's way too much. We can't get into it
Yeah.
in the next couple minutes, but there's so much more that we have to deal with. Those are my concerns. So
I think it's just so clear that, I can't believe this didn't turn into a federal election issue. And
right.
it's kind of like COVID, right? Where you don't, like, when the problem really manifests itself, when your ICUs start to get overloaded, putting in the public health measures at that point, it's a little too late, right?
Right.
And
No.
that's why it's been such a
Hmm.
frustrating experience. But I mean, we're at that stage where, the analogy of the nursing crisis, the ICU beds are all full. The system is in a real state of disarray. And so, it's hard to imagine, unfortunately, our political leadership really coming up with a kind of bold package that's required to retain nurses and stem the tide here. But I think I'm cautiously optimistic that the great work of this movement that's being driven by these grassroots frontline nurses, and I guess I'll throw you guys in there as well, can hopefully bring the public to their senses and to a point where they're demanding of their politicians that we deal with this. So, and I hope it doesn't have to get a lot worse before it can get better again. But yeah.
I mean, I completely agree, and I can't even imagine what much worse would look like. I think the fact is, when people say, our health care system is collapsing, no, it has collapsed. I think we're
Mhm.
beyond that point. And I mean, we really need to do a really good job of educating the public too, like, because they vote, right? We need to let them
Mhm.
know
Mhm.
what are we asking for. It's more than just money. It's about, having that dignity, having that respect, having the ability to practice in a safe environment so we can keep our patients and family members safe. I think that, those conversations are so hugely important to have. And I'm up for the challenge. I'm ready, right, Sarah? We're
Hmm.
ready. We're going to do
Hmm.
this.
We're ready. We're ready. Chris, I just wanted to thank you so much again for coming onto our podcast. This might be a bit premature, but I'm sensing a part 2 coming in the future to discuss some of the other passions that you have in medicine. Thank you so much for coming on.
Be so happy to come back. Thanks for having me, guys. A real pleasure.
Thank you, Chris.